Have you ever found yourself crossing your legs when you laugh, rushing to change your underwear after a sneeze, or carrying extra clothes because you wet your pants at the worst possible moments? If you're nodding your head right now, you're not alone, and what I'm about to share with you today could stop this embarrassing problem once and for all. This isn't just about a little embarrassing leak here and there. This is about completely stopping the pants-wetting episodes that are stealing your confidence and forcing you to plan your entire life around bathroom locations. The 6 habits I'm going to reveal are directly causing you to wet your pants, and they absolutely must be stopped if you want to reclaim your dignity and independence. Here's the empowering truth. Research shows that up to 70% of women who wet their pants can completely stop or dramatically reduce these accidents by avoiding these specific habits. By the end of this video, you'll discover the 6 dangerous habits that are directly causing 90% of women over 60 to wet their pants unexpectedly, and I'll share the most shocking revelation that could eliminate these accidents completely. You'll learn exactly why your body is betraying you in these embarrassing moments and how to stop it from happening ever again. Comment, "I'm ready," if you want to stop wetting your pants and learn what changes can eliminate these humiliating accidents from your life forever. And while you're here, please hit that subscribe button and ring the notification bell for Elderly Health Central for more practical solutions that can genuinely transform how you age with strength, confidence, and independence. You deserve to know what really works for your body, not just what sounds good. Let me start with the first habit that absolutely must be stopped, and this one might shock you because it seems so logical. Picture this. You've started wetting your pants when you cough or sneeze, so you decide to drink less water throughout the day. Makes perfect sense, right? Less liquid going in means less chance of accidents. But here's what most women don't realize: this dangerous dehydration mistake is actually making you wet your pants more often, not less. Research shows that when you don't drink enough water, your urine becomes highly concentrated and acidic. This concentrated urine irritates your bladder lining, causing it to spasm unpredictably and creating those sudden, uncontrollable urges that make you wet your pants without warning. Studies indicate that women who drink less than 6 glasses of water daily are actually 40% more likely to experience the type of sudden accidents that completely soak through their underwear. Most women think reducing fluids will prevent pants wetting, but here's what's really happening inside your body. Your irritated bladder muscles are getting confused signals, causing them to contract violently when you least expect it. Plus, dehydration leads to constipation, which puts additional pressure on your already sensitive bladder, making those embarrassing accidents even more likely. Here's what you absolutely must do to stop this habit from causing more pants wetting episodes. Aim for 6 to 8 glasses of water daily, but space them evenly throughout the day and reduce intake 2 hours before bedtime. If you're concerned about increased frequency, consult your healthcare provider immediately about the best hydration schedule to stop these accidents. But this dehydration habit isn't the only one causing you to wet your pants. The second habit that absolutely must be eliminated involves something most of us consume every single day without realizing it's making us wet our pants. Let me ask you something crucial. Do you start every morning with that essential cup of coffee, maybe have an afternoon tea, and enjoy a glass of wine with dinner? You're describing a daily routine that's creating what I call the caffeine and alcohol trap, a perfect recipe for unpredictable pants-wetting episodes. Caffeine and alcohol are what medical professionals call bladder irritants, and they're directly responsible for those sudden, humiliating moments when you wet your pants without any warning. Research shows that just 200 milligrams of caffeine, that's about 2 cups of coffee, can trigger unpredictable bladder spasms by up to 30% within 1 hour of consumption. Alcohol works differently but just as devastatingly. It suppresses the hormone that helps your kidneys conserve water, leading to increased urine production and reduced awareness of your bladder's fullness, setting you up for embarrassing accidents. Here's what most women miss. They experience morning bathroom urgency or evening pants-wetting episodes and think it's just aging, when really it's these daily beverages creating a cycle of bladder irritation and unpredictable accidents that completely soak through their clothes. This habit absolutely must be stopped if you want to eliminate pants-wetting episodes. Try reducing your caffeine intake by half for 2 weeks and limit alcohol to no more than 1 drink per day, preferably earlier in the evening. Keep a diary noting your fluid intake and any accidents. If you notice significant improvement, you found a major cause of your pants wetting problem. Always discuss these changes with your healthcare provider, especially if you're taking medications. The third habit that's causing you to wet your pants is something most women were never taught properly, and it absolutely must be addressed. You exercise your arms, your legs, maybe even your core muscles, but when was the last time you consciously exercised the muscles that are supposed to prevent you from wetting your pants? If you're like most women, the answer is probably never, and that's why you're having these devastating accidents. Your pelvic floor muscles are like a hammock that's supposed to prevent you from wetting your pants, and when they're weak, that hammock fails you at the worst possible moments. Studies indicate that women who perform targeted pelvic floor exercises, also called Kegel exercises, completely stop pants wetting episodes in up to 80% of cases within 12 weeks. But here's the crucial part. Most women either don't do them at all or do them incorrectly, which is why they keep having these humiliating accidents. Most women assume that wetting your pants during coughing, sneezing, or lifting is just an inevitable part of aging, but here's the truth that will shock you. Every time you neglect these muscles, you're basically guaranteeing that you'll wet your pants during everyday activities. It's like expecting a broken dam to hold back water. Here's exactly what you must do to stop wetting your pants. Tighten your pelvic floor muscles as if you're stopping the flow of urine midstream, hold for 3 seconds, then relax for 3 seconds. Work up to holding for 10 seconds at a time. Do this exercise 10 times, 3 times per day. The key is consistency. You need to do this every single day to stop these embarrassing accidents. If you're unsure you're doing them correctly, consult your healthcare provider immediately or ask for a referral to a pelvic floor physical therapist. But even perfect pelvic floor muscles can't prevent pants wetting if you don't eliminate this next dangerous habit. The fourth habit that absolutely must be stopped involves something that might shock you, what I call the constipation connection that's directly causing your pants wetting episodes. Your bowel health and your bladder control are intimately connected, and constipation is one of the biggest hidden causes of those sudden, uncontrollable accidents that completely soak through your clothes. Yet most women never make this life-changing connection. When you're constipated, your full bowel puts direct pressure on your bladder, reducing its capacity and making it more sensitive. Research shows that women who experience chronic constipation are twice as likely to develop urinary incontinence. But here's the part that really matters. When you strain during bowel movements, you're actually weakening the same pelvic floor muscles that support your bladder. Most families focus only on the bladder symptoms and completely miss this connection. They see the leakage and think bladder problem, when the real issue might be happening in the bathroom during bowel movements. Every time you strain and hold your breath while trying to have a bowel movement, you're creating downward pressure that stretches and weakens your pelvic support system. Here's your action plan. Increase your fiber intake gradually to 25 to 30 grams per day through fruits, vegetables, and whole grains. Make sure you're drinking enough water. Remember our first habit. Establish a regular bathroom routine, especially after meals when your body naturally wants to eliminate waste. Never strain or hold your breath during bowel movements. If constipation persists for more than a few days or becomes chronic, consult your healthcare provider about safe treatment options. This next habit is particularly dangerous because it creates a vicious cycle that gets worse over time. The fifth habit I need to talk to you about is smoking, and if you smoke, or if you smoked for years and quit, your bladder has been under attack in ways you probably never realized. Smoking doesn't just harm your lungs and heart, it's directly sabotaging your bladder control in multiple devastating ways. The nicotine in cigarettes irritates your bladder lining, making it overactive and unpredictable. But that's just the beginning. Chronic coughing from smoking puts enormous strain on your pelvic floor muscles every single day. Studies indicate that women who smoke are 3 times more likely to develop stress incontinence compared to non-smokers. Even former smokers who quit years ago may still experience these effects if the damage was significant. Here's what most families don't understand about the smoking and incontinence connection. They see the accidents and think it's just bad luck or genetics, when smoking has literally been weakening the bladder control system for years through chronic inflammation, reduced blood flow to pelvic tissues, and constant mechanical stress from coughing. If you currently smoke, quitting is the single most important thing you can do for your bladder health. Your healthcare provider can help you develop a safe, effective quitting plan that might include medications or support programs. If you're a former smoker experiencing bladder issues, don't assume the damage is permanent. Many women see improvement in bladder control within months of quitting as inflammation reduces and blood flow improves. But even if you've never smoked and you're doing everything else right, this final habit could be undermining all your efforts. The sixth habit might be the most surprising of all because it seems so harmless, what I call the holding pattern mistake. You feel the urge to urinate, but you're busy, so you hold it. Maybe you're in the middle of a conversation, watching a movie, or just don't want to interrupt what you're doing. This seemingly innocent delay is actually training your bladder to work against you. When you regularly ignore your bladder's signals, you're confusing the communication between your brain and bladder. Research shows that chronic urinary retention can stretch your bladder muscle, making it less efficient at emptying completely. This leads to frequent urination, sudden urges, and increased risk of urinary tract infections. Here's the immediate action you need to take. When your body signals it's time to urinate, respond within a reasonable time frame. Don't rush frantically, but don't ignore the signal for hours either. If you find yourself consistently holding urine due to fear of leakage or inconvenience, it's time to consult your healthcare provider about these concerns. Now here's the most important insight I promised you, the one that changes everything. All of these habits have one thing in common: they're completely within your control. You're not helpless against aging. You're not destined for embarrassment and limitation. Every single one of these habits can be modified starting today. But here's what makes this truly powerful. When you address these habits together, not individually, you create what researchers call a synergistic effect. Your hydration supports your pelvic floor exercises. Your improved bowel health reduces pressure on your bladder. Your reduced caffeine intake makes your pelvic floor work more effectively. It's not just 6 separate changes, it's one comprehensive approach to reclaiming your confidence. Aging with dignity isn't about avoiding every change your body goes through. It's about recognizing the signals early and responding with wisdom, knowledge, and proactive care. You have more power over your bladder health than you ever imagined, and that power grows stronger every day you apply what you've learned here. We're walking this health journey with you every single day, helping you feel stronger, more confident, and more prepared. If this insight has helped you today, consider joining our Elderly Health Central family, because your health journey deserves ongoing support and expert guidance that honors both your intelligence and your experience. To recap, the 6 habits we covered today. Dangerous dehydration, caffeine and alcohol overuse, ignoring your pelvic floor, constipation problems, smoking effects, and the holding pattern mistake, could be the difference between maintaining your independence and facing unnecessary decline. If you start recognizing these in yourself or a loved one, don't ignore them. Which of these warning signs have you noticed in yourself or an elderly loved one? Comment below and share your experience. Your story might help another family recognize something important. Sometimes just knowing you're not alone in this journey makes all the difference. If you found this health insight valuable and want to stay ahead of potential health challenges, consider subscribing to Elderly Health Central for more life-saving knowledge that can protect your independence and vitality. We're not just sharing information, we're building a community of women who refuse to let age define their limitations. Tomorrow, I'm sharing the one simple bathroom habit that can strengthen your pelvic floor without any formal exercise routine, something 95% of women don't know about, but that can make a dramatic difference in just 2 weeks. Thank you for prioritizing your health today. Remember, your health is your wealth, and knowledge is your power. You have everything you need to make positive changes starting right now. Stay informed, stay empowered, and I'll see you in the next video with more insights that can change your life.